Hi everyone, welcome to ResearchMD.com. Dr. PRAMIL is here. We're going to teach you a very examination-specific cardiology concept today, okay? So we're going to go through a clinical scenario first, and then we're going to look at what the most common wrong answer people usually talk, okay? So let's take a look at this clinical scenario. We got an 82-year-old patient, 82-year-old, the same male patient, shortness of breath, come with a shortness of breath, has multiple comorbidities. Okay, multiple comorbidities, and they did an echo and they found out the patient has severe aortic stenosis. So the question is, what is the next step? What are we supposed to do? So what is the most common wrong answer people usually take? People automatically are going to say, let's do a surgical AVR or aortic valve replacement. Okay, open up the patient, you put a new valve in. That is the most common wrong answer. Or they might say valvuloplasty, balloon valvuloplasty. Okay, so don't pick this answer. So what is the correct answer in this patient? There's something called TAVR. Okay, this is the answer. You go with the TAVR, which is transcatheter aortic valve replacement. A cardiologist can do, they put a cardiac catheterization and simple procedure to replace the valve. And why should we choose that as answer? Because you look at this patient, he got an 82-year-old, okay, elderly patient, multiple comorbidities. What happened if you take them to the surgery, right? Then most likely the mortality rate is extremely high, something bad is going to happen, okay? So each situation you have to look at it. 82-year-old, how much lifespan they have? Probably have like 10 years left, right? A good 10 years left, let's say. So what are our options? Our option, you do the simple procedure, not many complications. It's safe also, transcatheter aortic valve replacement, okay? This we say like TAVR. Now, let's also learn what are the indications for surgery in severe aortic stenosis, okay? When you talk about severe aortic stenosis, you have to know the size of the aortic valve, the area of the aortic valve. That's around, the normal is around, let's say, 4 centimeter. And in the severe aortic stenosis, the area become like so small, it becomes less than 0.8. Okay, that becomes severe. So when do you do surgery? First of all, let's look at some indications for surgery. In severe aortication, severe AS, okay? Only in severe AS. Number one, symptomatic severe aortic stenosis, okay? Symptomatic severe AS, okay? Number two, they could be asymptomatic also, okay? Asymptomatic severe AS and ejection fraction less than 50%, okay? Now the third thing I want you to remember, concomitant heart surgery. Let's say the patient is going for a CABG, and if they have a valve problem, they better fix it together. You can do it. There's no point in opening the patient up again, okay? So the things to remember, in an elderly patient, symptomatic aortic stenosis, don't go for surgical AVR. Always pick TAVR. Thanks so much for watching. God bless.